just these 5 and the 2 in Canada, and there's 1 in Mexico. So there you go. Here's a drug-filled world. You start out as babies, taking antibiotics, and then you can't pay attention in school, so you're on Ritalin. Maybe if you have body image problems, you're taking appetite suppressants, you're kind of anxious all through your younger 20s and your early 30s because you're starting a family and looking crazy, and we're getting older. And by the time we get here, 65 plus, we're just popping medications for everything, right? This is just, in the United States, that really is what it's like. And it's really, really sad. We are the most powerful, one of the most powerful country, but as far as healthcare goes, we are at number 30, according to the CDC, of developed countries. I'm not talking about third world. I'm talking about in Europe and Australia and other places. And this is what it looks like. Hence, now we come to what God has planned for us. Amen? You ready for it? Yes. I don't know. You don't sound convincing like you're ready for it. You ready? Yeah. Okay, good. We're ready. All right. So clinical nutrition. Look at that. Oh, isn't that beautiful? Okay. So again, I didn't come here to give you a lecture about what you should eat, what you shouldn't eat, and I really don't want to start it, and I'm inviting you and encouraging you not to ask me a whole bunch of questions about it after, because I'm going to shut it down real fast. Because it is individual. Like I said, it is my day job to look at everybody that comes, sits in front of me, they will have to fill out a diet diary over 6 days, every last thing they put in their mouth, whether it's a beverage or a food, and the quantities. I ate 1/4 a cup of rice with these steamed vegetables, and the brand of the box was this. This is how in depth I go through it. And as such, I tell you, diet is individual. So the same way that I'm sure my brother here in the perfect hue of purple I've ever seen, coat, blazer, would probably not want to be caught dead in these silver, glittery, pink high heels. I'm pretty sure. Oh, you got an AC. I'm not listening. Don't worry. We're here. We're not over there. The same thing is true with nutrition. We cannot either wear, none of us, even I wouldn't wear these. I was telling my brother over here too. My top of the heel line is 2.5. Past 2.5, it's going to be like, timber. Okay, I just can't walk in it. But if somebody else can, great. I can't. Okay? We cannot wear, I cannot put myself into a baby booty. Okay? I probably would wear these. I would not be wearing these. The same thing, diet is like shoe and shoe size. It is not one size fits all. Don't try to force people to wear your shoe or to wear their shoe. It really does depend on their lab work and composition. That's all I'm going to say about nutrition. If you want to know, though, there are guidelines of what you should and shouldn't eat, right? Because God made the body. So he knows, just like a car manufacturer knows how to make this car run. If you use this oil if you've got a Benz, or use this if you've got a Toyota, whatever. He knows. Does that make sense, or is it crazy talk? Yeah, he knows. So he did give us guidelines, and here they are in Leviticus 11. So you pray, ask him what you should eat, and discuss it with your doctor and with your condition that you have, and then you'll know what you need to eat. All right, let's move on to another therapy. So nutrition was one. Hydrotherapy, this is the use of water on the body to bring about healing. Okay, look at that, isn't that gorgeous? All right, so these are just a long list, and I'm not going to have time to go through all these. I'm just going to introduce you because I think I started at 4, so that means I've got about 9 minutes left. And I don't hear my timer, but it'll go off. All right, so hydrotherapy and uses, again, there's a billion different things that we can do. Castor oil cloths, helps move blood. We can use steam inhalation for people that have like bronchitis and things like that. We can use shower hydrotherapies, enemas, fever baths when we're trying to create a fever and help the white blood cells, your immune system. What I think of your body being like a country. So like the United States of you, put your name in there. So if I was a country, be like United States of Megan. North, south, east, west, think of each one of your organs as being like a city. So heart city, lung city, brain city, digestion city. All right, so as you're moving stuff and supplies around your body then, using hydrotherapy is great because it is basically using hot water is attracting blood, or basically your semi-trucks, right? Your delivery trucks for everything good that you want, to one area, and the cold is driving it away. That'd be like maybe your dump trucks taking away trash and stuff from the house. So we have a lot of different types of uses that we use it for. There's some. All right, let's move on. Environmental medicine. This is just us studying the fact that, again, we talked about it before, your body is building up toxins, not just from the things that you've been eating and drinking, etc., but it's also from things like the vinyl in your shower curtains and all the different colors and dyes that are on your clothing and in your cosmetic products, lotions, shampoos, etc. All of these things have chemicals in them, and they're building up if you're not helping your body to rid it. And it's trying to rid it, right? But again, when it gets overwhelmed, it loses that ability, and then you go from this nice little bucket right here to looking like this thing. So then you get some disease name, no matter whatever you call it. So, like I said, they come from everywhere. Paint cleaners, farmed fish, non-organic butter, that's foods and other things. So in environmental medicine, we kind of learn how to pull those things out of the body using chelation or using supplements or using, again, hydrotherapy. Lots of different ways, right? Now I love using detoxes and cleansing and stuff. Herbal medicine, that's using plants as medicine. Okay? And so then again, there's different parts of the plants. One part, the stem might be good for lowering blood pressure. The root might be better for decreasing cholesterol. The flower might be used to increase your heart rate. And so there's different ways that we can use plants as well. We can use them in liquid form, which we call a tincture. We can use them in dried form, like herbs you've seen, and then we can use them, again, topically in different kinds of lotions and creams and stuff. And in general, when you use plants, they tend to help the body to heal instead of just treating symptoms and making you think you're okay, but you're not. Make sense, or is this crazy talk? Awesome. All right, great. Physical medicine. This is what chiropractors do. They're a lot more well-versed than we are at this. We just do about 200 hours in naturopathic medical school compared to what chiropractors do, which is 2,000 hours. So we just get the introduction, and really what I end up doing is I refer to a chiropractor when I know that your problem would be primarily physically based. Okay, so again, as you can see, everything's connected in the body from the top of the head, goes through the spine. And you may think, oh, crack 'em, whack 'em, that's what chiropractors are for. No, right? Structure affects function. So if your ribs, a lot of your stuff is encased in bone. And as it's going down your spinal cord, it's going to come out via nerves and connect to all your organs too. So the same way that you can write really well when you're writing on a piece of paper, right? Okay, that's my 5-minute mark. Then if I were to now hang you from the ceiling and then say, my brothers, my sisters, go ahead and keep on writing on that paper, it wouldn't work too well, would it? No. So structure affects function, and that's why we like physical medicine, to keep things moving as they should. All right? But there's different types, not just chiropractors. We have all these different kinds of machines. You've seen this one, ultrasound, and you're thinking, ultrasound, that's just used in pregnancy. No, it can be used as healing too. We can heal pain with it. We can use it for long-term illnesses as well. TENS is another one, says pain, microcurrent, for different, stimulating the body on a very small level. Okay, physical massage you've heard of, and again, physical manipulation. Alrighty. Mind-body medicine. Again, we're talking about modalities. In case you're wondering, where are we in all this? We're talking about the main 7 natural therapies that exist in naturopathic medicine to help a person heal. And this is basically just addressing the mental and emotional aspects of healing. So people that have like phobias, post-traumatic stress disorder, depression, anxiety, panic attacks, suicidal thoughts, they can all benefit from using these kind of therapies. And some of them, I just mentioned a few: biofeedback, neurofeedback, where we actually attach electrodes to the person, and then you can see things like your heart rate. You know, usually you can't see how fast your heart is beating. But when you're talking about how my grandmother used to always tell me I was stupid and ugly and I'd never amount to anything in life, you might be 85 telling me that, as patients will be. And then you can attach, and they can then see how, whoa, how I thought I was okay, I was fine. No, it's okay, I can talk about it. No, you're not fine, because look what your heart is doing right now. You may not feel it, but it's doing that, and that's causing you harm. You see, that's what another way you can kind of translate that phrase: the organs weak, tears that the eyes cannot shed. We might cognitively think we're okay, but the body knows you're not okay. You know? Does it make sense, or is it crazy talk? So we use these kind of things. I only put asterisks near anxiety and suicidal thought, and I thought I put one, yeah, near depression, just because remember that actually some of these things are not even just from an event, but can be side effects of medications. For example, there's many people that are on antidepressants, but one of the side effects is depression. So, you know, and suicidal thought and a lot of other things. So anti-seizure medications as well can make you have a seizure. So just keep in mind that sometimes your symptoms might actually be either the one drug alone or the cocktail of medications that you're on that can be causing that. Okay, traditional Chinese medicine. So this is using acupuncture, Chinese herbs, nutrition, there's massage, and there's movement, Tai Chi and Qi Gong, okay? And this is not tattooing, in case you're wondering. There's no pain, there's no blood. I've heard a lot of interesting theories on this. No, okay? Works on the energetic principle. The body does have energy in it, as well as electrical fields, the same electrical fields that power our power lines and things like that. I mean, the same concept, right? The heart is an electrical system. Homeopathy, this works like a vaccine, like clears like. So again, what you do when you get a vaccine is they give you a part, let's say, of a virus, right? Flu virus is a common one. They give you a little bit of the virus. Sometimes, usually they don't use live viruses anymore, meaning like the virus really is alive. They don't do that. They usually use a part of the virus, like one of his legs or something. Or the virus, he's dead already, and then they inject that in, and then it incites your body's immune system, which again, if you think of your body like a country, your immune system is like your Army, Navy, local police, Marines, okay? To be like, hey, what was that virus piece? That's not one of us, let's attack it. That's what a vaccine does, or what it's supposed to do, okay? Homeopathic medicine works the same way, okay? So now we come to the cases, acute otitis media. Now we're just drawing everything in of those 7 therapies to kind of show you again how the different types of medicine and doctors might address something like this. So this acute otitis media is just another name for an ear infection, right? So little kids are usually the main ones getting ear infections. All right, so again, in conventional medicine, they might just treat with an antibiotic. And a doctor of osteopathic medicine might treat with manipulating or moving around the neck and the ear. And a naturopathic doctor might do any one of those things, or even use any of these things: hydrotherapy, which is water, herbs, acupuncture, endonasal technique, NAC, this is a supplement, essential oils, different things, right? So just so you get an idea. So here's the case. Mark, 45 years old, multiple sclerosis. Okay, in conventional medicine, he'd already tried a whole bunch of these things and was still doing some of them. Drugs, just basically since multiple sclerosis is your immune system or your police attacking you, then using those things to lower, yep. Okay, I'm giving myself 5 minutes more too, because you got 5 minutes more. But then after that, that's it. Fair is fair. All right, but yeah, seriously, I'm near the end. Okay. That's it. And then muscle relaxants, etc. But he literally he rolled into the clinic, okay? So we had tried all those things, really didn't feel like he was getting anywhere with it, so it was like, is there anything else out there that we can do? And we're like, sure, there's tons of stuff. Let's try it. So under our model, again, we were working with him, doing nutrition, supplements, again, nutrition that is ideal to him, right? Not just everybody that's been diagnosed with multiple sclerosis, right? All right, so then we were doing acupuncture, we were using herbs, we were using homeopathic medicine, environmental medicine, pulling out some of the toxins that caused the multiple sclerosis in the first place, right? Because we've got to get down to the cause. Remember, that was one of our principles. Where is it coming from? All right, came in a wheelchair, and in a couple of weeks, about 6 to 7 weeks, he was already on crutches, able to walk. So that was nice. He was excited, we loved it. Now, as far as my specialty goes, who do I work with? Well, not frogs. But I do work with women primarily, and men, whose lives are disrupted by digestive troubles, again, because they really are excessively burpy, bloaty, gassy, or anything else nasty. And I kind of help them to get out of the bathroom, or at least stop thinking about the bathroom all the time, and to get back into a fun life. All right, that's who my specialty is, the digestive system. All right, And digestion is the process of breaking down something really, really big that you can see, like an apple, into something teeny, teeny, and tiny that you cannot see, like vitamin B12 for nerve function and for your heart to work right. All right, so that's me. And I also do diabetes education, since that falls, and working with people who have diabetes, because that falls again within, right in my specialty. All right, so here's another story for you. Jonathan, 18-year-old high school student. Okay, so this is not him, by the way. This is an actor. But he was waking up with nausea, with bloating, just 18, right? So age is not always, you're thinking we have to get old and sick and die, and that's not biblical, by the way, is it? Right? We were promised 120 years, right? So, and there's people all over the world that die just from old age. They're not sick and dying. Here in Western countries, we've gotten into this idea is as we age, we must get sick and then we must die. Even Moses and Joshua, when you go back and read in the Bible, said, at my age, I can still go out to battle and come back in as fresh as when I went out. And he was old at that time when he wrote that, so same thing. So it doesn't, age has nothing to do with it. Jonathan, 18-year-old, like I said, they kicked him out of the SAT because he had to get up so many times and go and vomit in the bathroom that they thought he was cheating. Okay? It wasn't that. He had a digestive system problem. At his prom, he got up, again, about 3 times at the dinner. He was a spaghetti factory. He was very upset about that. Got up, had to get up, and he had diarrhea at that time. So digestive system messed up. So we worked again. Nutrition with him, testing, etc., cleansing, and now he's off in college, enjoying life as he should. Yvonne, 58-year-old teacher, then and now. She has diabetes and high blood pressure, overweight, tired, no joy. Okay, married, adult children. So we've been working, we're still working together now. She, again, using some of the same things.